Well, cancer is life-changing, and if you look around, you will probably notice someone going through the journey. In our Buddy Check 3 report tonight, what comes after finishing treatment? We are marking milestones.
We're just going to warm up a little bit.
When these people met for the first time, they knew they had something in common.
They support each other, they're there for each other, and it's just amazing to see them grow closer together.
Cancer survivors, their biggest concern, what happens after treatment. This survivorship class offers answers.
Basically, the class is telling us to live. Live the day as though it's not your last.
Diagnosed with breast cancer in 2010, just 6 months after her annual mammogram, Valerie Murchison says the class wipes away her worries.
This class is teaching us how to be calm, not to be fearful, not to be thinking all the time that everything that I eat, everything I do may cause the cancer.
Breast cancer survivor Ann Smith says knowing what to expect makes a difference.
Well, one thing that really helped is getting together with other folks that are going through the same thing, and they had people talk to us about nutrition and diet and medical terms and what to expect and what changes happen, long-term effects.
As this cancer transition class ends, these graduates are first to mark a new and personal tradition at the Lewis Cancer Pavilion.
Ring this bell 3 times well. It's told to clearly say, my treatment's done, or a milestone won, and I am on my way.
That bell clarified to me that, hey, you are alive, you're healthy, so live. And that's what I'm doing, is I'm living.
Medical teams at Savannah hospitals are deep in the trenches. Their workload increased to handle a national drug shortage.
We're probably, putting anywhere from 10 to 20 hours of man hours trying to find different medications.
Memorial's pharmacy director Ken Josephchek says some are life-saving drugs.
We probably have about 40 drugs that we manage very closely.
Many are drugs they thought they would never have a problem getting. That list includes electrolytes, potassium chloride, and sodium bicarbonate, which is used to maintain an acid-base balance.
It's very important to us in our critical care patients especially.
So those crucial drugs are given to the patients most in need, and an alternative is used for patients not critical. The FDA blames the short supply of medicines on quality problems and drug companies deciding to stop making medicines. St. Joseph's Candler is also scrambling to fight the medication shortage. Employees work hard to track those drugs in short supply.
We have frequently had to make clinical decisions to substitute an available medication for one that might be originally prescribed by the physician because we simply were not able to get it.
Pharmacy Director Ray Maddox says the shortage is improving, but they still have difficulty getting key drugs like propofol. It's used to sedate patients for surgery.
A year or so ago you just about could not get it. We now can get it, but the problem is tomorrow we may try to order some more propofol and it be on back order or not able to be supplied in the quantities that we need.
Here's how they manage the crisis to ensure that the patient gets quality care.
We, depending upon the drug and the condition that's involved, for both nurses as well as our pharmacy staff, for specific drugs that we're having to substitute, have made printed materials and electronic information in our computer system that names the drug that's in short supply, the drug or drugs that we're going to be using in place of it, and the equivalent dose.
Another drug hard to get their hands on is leucovorin to treat cancer.
There have been some patients, I think on the outpatient side, where we've had to delay treatment because none of that drug was available.
It's a small pill. It's not a big pill, which is good for him to be able to swallow, and he just takes one a day. They all pretty much look the same. They just have different colors.
Sandra Diallo lives with desperate hope that she will be able to get the medication her son needs to get him through the day. 8-year-old Anthony has attention deficit disorder. He's been on Concerta for 4.5 years.
There was a time at one of the pharmacies that I put in the prescription. They said it would be ready that night. I went to go pick it up. It wasn't. They said it would be 3 or 4 days. They would give me a call, and I said, okay, I got a couple of pills at home, but I really, really need it because I only have 2 or 3 pills at home. And it turned into 15 days.
If Anthony were unable to get the medicine, it could lead to scary consequences.
If he were to go a couple of days without it, he gets social anxiety, would not be able to deal with that in the school and have a hard time functioning, as well as not be able to learn and do what he needs to do to be able to move on and be successful.
Since it's been so difficult to hunt down the medication, Sandra hopes the drug shortage will be resolved soon.
If maybe there were more options available for the medication so that they would be able to get them out quicker and get them out to everyone, because I do know several parents that have had issues.
Back at the hospitals, they keep working with what they have and looking forward to the day when there's a plentiful supply of all medications.
Probably for the first time in 5 or 6 years, we're starting to see a decreased number of new drug shortages every month. So that's the good news. The bad news is there's still a lot of drugs on that list.
It's important for patients in the community to know that all of the medical community, physicians, pharmacists, nurses, all of us are committed, highly committed to giving the highest quality of care in our community, even when we face difficulties with medications.
Here's a good one, right there. That's you and your whole family and going fishing.
Paul McKinney was doing all the enjoyable things that life offered him 16 years ago until a heartbreaking change to his body. Diagnosed with diabetes in 1996, he vowed to fight the disease.
Well, I really attacked it really hard. Did what the doctor said, lost a bunch of weight. Everything was going great. So I didn't think I needed the medicine anymore or anything. And 2008, I started losing parts of my body.
The first scare came after a shower.
I looked at my foot and the calluses had broke open.
A doctor's appointment days later resulted in the unimaginable.
My 2 middle toes on my right foot were solid black. And so I went into the hospital and they cut the first toe and the bone behind it off. Well, you would have thought that woke me up, but I tried to do better.
The sad truth is, Paul failed to manage his diabetes.
I could have watched what I ate more. The hamburgers and being in the restaurant business, grabbing food when you are hungry and eating instead of watching what you eat. I could have controlled my diabetes better.
2 more surgeries took the front half of his right foot. Then, in 2009, during an operation, Paul was not prepared for these words.
My surgeon walked in and said, "We're going to take your leg." And that was hard.
The scary reality for Paul, how would he ever walk again? Filled with pain, Paul was later fitted with a prosthetic left leg. The new season in his life would require round-the-clock support. Paul's wife, Coral, is his strength. She does what Paul cannot do for himself.
She could have left me at any time during this process she wanted to. I don't think I could. Well, I'd have never made it through without her.
Paul acknowledges that his situation could have been avoided if he had kept his blood sugar levels under control. His warning to all diabetics, take care of yourself.
The doctors, the nurses, anybody can tell you what they want to tell you. But if you don't take care of yourself and you don't take control, this is what you've got to look forward to.
Through it all, Paul has experienced some happy moments.
And the first time I got back in the truck to drive was unbelievable. First steps, I took them into the lake. It was like being born again.
His road to recovery has been a challenge and required sacrifice, but through the obstacles, he's learned to keep a positive attitude. After all, he has so much to be thankful for.
To still be alive is a great thing. If I could go back and do things differently, God, yes, I would.